Hello, welcome back. So here you are seeing the sagittal section of the head and neck. Today in this video, we will learn the nasal septum and lateral wall of nose. So here you are seeing the nasal septum. It is a median osseo-cartilaginous septum separating the two nasal cavities. It is formed by bone and cartilage. Now let us see what are the bony parts and cartilaginous part of nasal septum. The posto-superior part is formed by the perpendicular plate of ethmoid bone. Okay, so here you see the ethmoid bone. It has got a perpendicular plate, and the posto-superior part of the nasal septum is formed by the perpendicular plate of ethmoid bone, and posto-inferior part is formed by the vomer. These are the bony parts, and anteriorly we have the cartilaginous part. The major part of the cartilaginous part is formed by the septal cartilage, which forms the antero-inferior part of the nasal septum, and this lowermost part is formed by the septal process of two major alar cartilages. Now, what are the arteries to supply the nasal septum? So the nasal septum is supplied by, so here we have septal branch of anterior ethmoidal artery. Then we have the sphenopalatine artery from here. From here we have the posterior ethmoidal artery, and from here we have the greater palatine artery. And from this area, anterior-most part, so we have the superior labial branch of facial artery. So these all arteries anastomosis at the antero-inferior aspect of the nasal septum, and this particular area is known as the Little's area. So the arterial anastomosis which takes place at this Little's area is known as the Kissel's-Bags plexus. Okay, so the rupture of this plexus may causes nasal bleeding, and the nasal bleeding is known as the epistaxis. Now let us learn the lateral wall of the nose. So we have removed the nasal septum, and you are seeing the lateral wall of the nose. The lateral wall of the nose has got three shelf-like projections. These shelf-like projections are known as the nasal conchae. So we have superior nasal conchae, middle nasal conchae, and inferior nasal conchae. And the cavity below this conchae is known as a meatus. So we have superior meatus, we have the middle meatus, and below we have the inferior meatus. So this superior and middle nasal conchae are the projections on the medial surface of ethmoidal labyrinth, whereas the inferior nasal conchae is a separate bone. There are some openings in this meatus. Let us see what are the structures opens into this meatus. So here we have the sphenoidal air sinuses just above the superior nasal conchae. So there is opening of sphenoidal air sinuses. In the superior meatus, we have the opening of posterior ethmoidal air sinuses. So let us see the middle meatus in detail. When we lift this middle nasal conchae, you can see there is an elevation. So this elevation is known as the ethmoid bulla, and there is a sulcus deep to this ethmoid bulla. So this sulcus is known as the hiatus semilunaris. So here we have the ethmoid bulla, and this is the hiatus semilunaris. Above the ethmoid bulla, there is an opening. This is the opening of middle ethmoidal air sinuses. Hiatus semilunaris presents three openings. One is at the anterior end, one is in the posterior, and one is at the middle part. The one which opens in the anterior most part is the opening of frontal air sinuses, and at the middle part we have the opening of anterior ethmoidal sinus, and the posterior most part we have the opening of maxillary air sinuses. Now this is the inferior nasal conchae. Below the inferior conchae we have the inferior meatus. At the inferior meatus we can see there is opening of nasolacrimal duct.